Ladies and gentlemen, welcome to today's debate. The motion for debate today is assisted suicide, the right to live or the right to die. Now, before I introduce my argument in support of this motion, allow me to first define what assisted suicide is. Assisted suicide is defined as the deliberate act or practice of ending the patient's life in order to limit the patient's suffering. This can be aided by a physician or an individual who does not have any monetary gain to it. Now, with that in mind, my first reason is it is absolutely an individual's right to end their life, particularly when they're suffering from a terminal illness or they are in a persistent vegetative state. Also, assisted suicide could encourage organ transplantation as it would give other patients who are suffering from organ failure a chance to live. So by virtue of that, one could argue that assisted suicide actually upholds the right to live by honoring the right to die with dignity. My co-debater, Miss Miao, speaks of the Hippocratic Oath. It must be the one from many decades ago, because the one that was recently adopted in 2017 by the World Medical Association in Chicago clearly states that I will respect the autonomy and dignity of a patient, and that is the most important thing. And in addition, I'm glad she actually brings up family and doctors because they are the main caregivers to patients who are suffering from this terminal illness or this incurable diseases. And this already places a burden on them. We're talking mentally, physically, socially, uh, financially. Speaking of financially, assisted suicide could save the government and doctors resources and money that can be redistributed to other patients who have a better chance of living. Miss Miao speaks of how assisted suicide could place less value on life and it could be used for criminal acts, but that cannot be far from the truth. Allow me to use Switzerland as an example, which is one of the few countries in the world where assisted suicide is legal. You see, in Switzerland, there are strict policies and measures and regulations to ensure that assisted suicide is not abused. And this is trusted by the population and even foreigners. As a matter of fact, one of the well-known organizations in Switzerland reported that about 90% of its members are foreigners, and this somehow led to a death tourism in the country. In 2014, the Swiss Federal Office of Statistics reported that majority of those who use assisted suicide were within the age range of 75 to 84 years old, and they were suffering from neurodegenerative diseases. Now, this clearly tells you it is not being used just anyhow. It does not mean people place less value on their life. It means people think clear and hard about this decision, and they decide why delay the inevitable when they can just give everyone, including themselves, peace by using assisted suicide. Thank you.
The proposition speaker has told us an individual has a right to die. But on the contrary, there is no firm philosophical argument for right to die. To support my thought, an old saying from China where I come from says that our bodies are given by our parents, and it's extremely disrespectful to our parents if we do harms to our bodies intentionally without parents' permission. No parents, well, except from few cases, would like to see their adult children die in front of them, even though death is their voluntary decision. And most importantly, they will live under the sorrow and psychological trauma for the rest of their lives. From the medical ethics point of view, Hippocratic Oath clearly states, I will neither give a deadly drug to anybody if asked for it, nor will I advise such a plan. The duty of medical professionals is to save lives. Who would like to trust doctors who prescribed poisons to the patients? Well, it may be true that assisted suicide could help a better allocation of resources for other patients. But have you thought about the ideal of giving up lives would also increase the suicide rates? The practice of assisted suicide may give to the general population a negative impression that life is not valuable, especially to adolescents. On the other hand, the service of assisted suicide could be misused and become a new form of crimes. My co-debater was claiming that Switzerland has a very strict legislation, which is very successful so far. But bear in mind that every law has its loophole, and at some point there will be someone who attempt to cross the border. Like what happened in the Netherlands in 2019. Dutch authorities prosecuted a doctor for performing euthanasia on the patient in the first case of its kind since its legalization 19 years ago. Ladies and gentlemen, I believe that assisted suicide is not the best or the only way of ending sufferings. Many studies have shown that palliative care is an efficient alternative. And please remember that when the person is looking for ending his or her own life, a lot of other people around the world with similar health conditions are combating and struggling to prolong their lives. Let's be hopeful that new treatments would be developed for terminal diseases in the near future. Thank you.